So thank you all for letting me come in. I am going to talk a little bit more about the research here, what our students at UM-Dearborn are experiencing. Mind you, the presentation that was referred to earlier takes usually about a half hour, so I'm going to do this very quickly, okay? So next slide. Well, next slide too. So I'm going to go over the Healthy Minds data, which we have 4 years worth of data. It is the most nationally recognized survey for college students' mental health. And I will kind of show that there are the differences amongst the years, how CAPS has responded to this data, and then quickly, very quickly, recommendations. All right, next slide. I already went through that, we're good. All right, so here's some of the cross-year comparison. There is a lot of data each year. The Healthy Minds survey gives us about 300 pages worth of just data on our students' mental health and well-being. So this snapshot that I'm giving all of you today is by far a small fraction of the data we have. So if anyone is interested in this, please feel free to contact me. But you can kind of see here, these were questions that were asked to students of how you're feeling in the last 2 weeks here at UM-Dearborn in the 2017-18 year, 18-19, 19-20, and then again in 2021. So just because of the way that we actually collected this data, we can see what impact COVID had really on our students' mental health and well-being. And I know a lot of the times media talked about how that was really difficult, and I do believe it was really difficult, but you don't see those changes in our number with our students. And I think that the reason why is that our numbers are really high to begin with. When you look at the data we can compare to other universities, we're some of the highest on a lot of these questions. So I think the reason we didn't see a big impact, like has been talked about, was just because of those numbers being so high. So that first column there has had little interest or pleasure in doing things. Second one is felt down, depressed, or helpless. Felt tired or had little energy is that third column. And the fourth one is felt nervous, anxious, or on edge. So you can see our students are struggling. Next slide. Here's some more, and I'm going to have to stand up. I'm so used to walking around while presenting that I have to be able to stand up. I'm sorry. I'm going to break the pattern here. This one here is engaging in non-suicidal self-injury in the past year, showing about 20% of our students, so about 1 in 5 in our students have experienced that. Experienced suicidal ideation in the last year. Again, anywhere from 11% to 16%, depending on the year. Received mental health therapy in the last year, only in the 20s to 30s. But we're seeing these other numbers being a lot higher, right? So the need is still there. Having a lifetime diagnosis of mental health disorder, again, closer to the people who are actually going to therapy. And then this one, admitting I have a current need for therapy. 77% was the most recent number, but yet only 22% was receiving that. Next slide. Here's just some more information. We are able to tabulate within the Healthy Minds if a person would actually be diagnosed based on the information they are giving us with certain diagnoses. This first one is how many individuals that responded to the survey actually meet the qualifications for currently experiencing a major depressive episode. This one has depression overall, so it could qualify in the numerous different categories related to depression. Almost half of our students having that. Anxiety disorders, about 34%, and eating disorders, about 10% of our students. And you can see this big number here, anywhere between 72 and 83% say that, yeah, what I'm experiencing definitely has a negative impact on my mental health and academic success as well. And this number, which I'm always so sad about as the director of CAPS, that only about 60% of our students who self-responded to a survey about mental health knew we existed on campus. Although that is higher than before, it still shows we have a long way to go. Next slide. This, I think, is something that's also really unique here for UM-Dearborn and important for all of us to be able to think about, is one of the reasons that people often talk about not coming into therapy is the stigma associated with it. This number here answers the question, if I went to therapy, or if your friend went into therapy, would you look at them differently? And sadly, still 5 to 7% of our students said yes. So they actually hold stigma about mental health services. But then there's this belief here that, yeah, if I went to therapy, people would judge me differently. The majority of our students are very close to believe that that's the case, when the reality is the majority of our students would not judge each other. But that stigma still exists and stops people from walking into our doors. Next slide. So this kind of gives you some information just very briefly about what CAPS data's looked like. We've seen an increase in the number of unique students coming in every year, except for that year where we were 100% remote. And I do not think that was because students weren't struggling. We see from the winter 2021 data that they were, but I think it goes to the unique nature of our students. The majority of them are commuter students who are living at home. If you are now at home, unable to come to CAPS, and your issue is related to your family, are you going to have a session with them by the next wall over? No. So I think a lot of our students struggled on their own in isolation during that time. And that is why I think we saw that huge increase as soon as we started offering in-person or Zoom room for students. And I ran the data before I came here today, and we are definitely on track to break that record, which is our highest amount of students and appointments given last year, this year. Next slide. So what we've been trying to do with all this data? Well, we've been trying to go out and do presentations like I'm doing here today to get this information out there in the hands of people, but also trying to create cross-cultural teams to implement some of the recommendations received from Healthy Minds and JED. So if any of you are here interested in working on more wellness work, please let me know. We would be glad to connect you with the Wellness Collaborative, which is made up of students, staff, and faculty who work on more of that preventative nature related to mental health. We've done more outreaches and liaisons to different academic departments, recognizing getting information in the hands of faculty especially is really important. As the survey showed, next to their peers, students are most likely to talk to faculty about their mental health struggles. We do QPR training for faculty, staff, and students related to suicide prevention, but really those skills learned during that presentation could really help with all mental health struggles. We also have an after-hours service that we implemented, recognizing people might struggle on the weekend or after 5 o'clock or during breaks when they're at home, and they need to be able to talk to a quality level clinician. And so if our students call that after-hour numbers, that's an extension of us at CAPS. It is a licensed mental health clinician answering that phone number who then gets in contact me as the director to follow up with them the next business day to create that wraparound care. We do Wellness Wednesday emails that go out to any students, staff, or faculty who are interested. There's also the Silver Cloud app that is free for anyone with a UMich email that helps you really be able to look at your own wellness and mental health. We created a YouTube playlist connected to the university's YouTube channel. Again, during that time of COVID, recognizing our students were still struggling, but may not be able to have those individual appointments. We started doing presentations and putting them online and saw a huge increase of students actually watching them, really kind of backing up that they were struggling, but they could stick in their ear pods and listen to a presentation on what to do, more than be able to go to a Zoom meeting. We also mentioned earlier that they're more likely to talk to peers first, right? So we created a program called the Mental Health and Wellness Peer Educators, where we actually hire 8 to 10-ish students here at UM-Dearborn and provide them a pretty extensive training on how to be able to help support their peers. And they do wellness tables, they do support groups, really be able to try to get that information out there, because students might be more likely to go talk to another student before they come to my office. And we also just started doing psychological assessments, recognizing again that there might be students who have undiagnosed impairments just because they've never really gotten in front of a psychologist. And those are, especially for those in the clinical field, super expensive to get and very rarely covered from insurances. So we're really excited to finally be able to offer that to students. Next slide. We also have a commitment to diversity, equity, and inclusion, recognizing we have a diverse campus that has a lot of unique variables, and we want to be able to make sure that we are always staying in touch and aware of where we need to do to be able to help support our campus best. New or coming soon this semester is we started doing some mental health Instagram messaging, and also on the weekly Dean of Students email, there's always information about mental health, recognizing that it's important to have information come from everywhere so that students are getting this information. So next time we do this survey, hopefully the number will be higher than 60%, being aware that we exist. We also started a psychiatric partnership with University Health Services, recognizing that students might have barriers to getting psychiatric services. Maybe they're underinsured, maybe they're insured but under their parents' insurance and their parents are not supportive of mental health treatment. And so this is a way for students to connect with CAPS to get free services without even having to drive to Ann Arbor. They can if they choose. They can just come to our Zoom room and log in and see the psychiatrist that's in Ann Arbor without having to ever leave campus here. And then starting hopefully next week, actually, because they just completed this past Saturday their final test, we'll have a therapy dog in the office 2 days a week. So yeah, super excited to have Moses on campus soon. There'll be announcements for that. Yes, you can come on over right next door. All right, next slide. And then last, what are some recommendations? Things like this, involvement of the entire campus community. campus-wide strategic planning, be able to recognize that this is an important thing, not just for CAPS to go and talk about, but for everyone to talk about and everyone to play a role in our students and campus mental health. Additional support for faculty and staff. You know, one of the biggest challenges we have is when we do events like this is the people who have an interest, who are aware a lot of times that this is a problem, which is great. We want to give you all the resources. But what about those who don't yet recognize? How do we get this information to them and help them be able to see that this is something that their students in their classrooms or in their advising sessions are struggling with? Doing more cross-campus campaigns to help identify students who might be feeling isolated. So using things like the Care Report more, so that we really can be able to wrap the resources that we have on campus around our students to help them be successful. Implementing more mental health campaigns, some more wellness day activities, and then for all those faculty out there, being aware that CAPS also has a ton of resources for how, no matter what your field is, you can implement mindfulness practices, mental health awareness into your topics too. So again, that was my spiel very quickly. If you ever have more questions, please feel free to reach out.